This area right here actually used to be our main hospital lobby. As COVID continued to increase, we ended up making this our emergency department lobby. And COVID continued to increase the demand for the hospital, and we had to turn this into a COVID holding area for our inpatients that don't have rooms upstairs.
Hello? Cool. So that's straightforward. We'll be about it.
This whole area here used to be where we would see low acuity and middle acuity patients. We've had to wall this off with a temporary structure to make this an entire area of negative pressure so that we can hold more COVID patients here.
Last one, huh? I just because of the, you think about like losing or
Yeah, like Cleveland.
Hi, how are you? Good, thank you.
Okay.
maybe the rushing.
It's tough, yeah. It's tough.
But she's not.
It's been a tremendous impact. The patients who are coming in with COVID-like symptoms has increased significantly. It's definitely put a strain on what we could do with the space we have.
Sorry, Mindy. No, it was nothing.
So this area is a tent that we had to set up to do our triage of patients when they first arrive and for providers to see them. This is something we used to do inside the building, but with COVID exploding in the area, we just didn't have the space anymore. Everything was taken by the COVID patients who are holding for upstairs.
Oh yeah.
They just tested me and it came out positive. They're not going to keep me here. There's no need because I don't have fevers. They told me a couple hours ago that I tested positive, which I'm still shocked about it. But they're sending me home with the home kits to test. They're going to be calling me. Don't touch it. I'll just wash the blanket and the pillowcases when I get there. It tells me that I was doing everything right, but you have to do more, I guess. Or these people out here, they're not paying attention. The gatherings, parties, Thanksgiving, everybody wants to be together on the holidays. Right now in this crisis, we can't do that. We have to stay home. We have to protect ourselves. We have to protect the people out there. We have to protect our children. I'm better, but I have to quarantine for 7 to 10 days myself. They're going to be calling me at home to check my status. Now I have to go home and take care of my son and make sure he's okay. You know, I need to get him tested. I need to quarantine myself. I need to figure this all out now. I mean, I don't want to scare my son, but he's already scared. He's been scared since the whole thing started.
Yeah. If you feel one of those, I can put it against here, against this wall, and I can get all those supplies, clean up the shit, and isolate. No problem. Don't be coming in.
It looks like really thinking about it, but it wouldn't let it go through. It's funny that it uses my name.
And we are one of 3 hospitals up here. We're a small community hospital. So we have a large supply of patients, and I feel that we have a shortage of beds at times. I know today that we have 60 patients holding in our emergency department that are waiting for beds inside the hospital. Some of them have been there as long as 7 days waiting. And that is very difficult. We want to be able to provide them with high-level care all the time, and the emergency department isn't always the best place for that to happen. So finding room for all of the patients during COVID, because there's definitely been a larger surge coming in the house.
3 more tellies right there. And then we talked about if there were empty beds on med-surg.
And unfortunately, because of the COVID-19 situation, we're out of ratio in the majority of our inpatient units, which means that the nurse is taking care of more patients than is ideal, right? So we have done a lot of creative things where we look at surgeries on a daily basis, and we redeploy staff from those areas to help supplement care and support the caregivers that are in those units, particularly the nurses, right? But we are out of ratio, and I believe probably majority of the hospitals in California are also the same, and that's really hard on it's hard on the staff.